Welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana, so let's get right to your questions. What if a senior I know is having trouble affording nutritious meals? That is a big concern, and in our home care practice, we hear this all the time. Federal, state, and local nutrition programs serve older people living on limited income. Meals on Wheels type programs, meal programs through senior centers, the Supplemental Nutrition Assistance Program, SNAP, formerly known as the Food Stamp Program, and the Emergency Food Assistance Program are a few of these. Contact your local senior assistance agency to learn about these resources. There are also ways to eat well for less money. For example, frozen canned vegetables and fruits are for the most part just as nutritious as fresh. Just don't select frozen veggies with buttery sauce, canned veggies with a lot of salt, or fruits packaged in syrup. Our next question, what if it's difficult for a senior to go to the store or prepare meals? Health conditions such as arthritis, visual impairment, and a stroke may make everything a little harder, and nutrition often suffers when a senior can no longer drive. Meals on Wheels and other dining options can help. If a family lives nearby, maybe consider making a weekly worth of nutritious meals for them and drop them off. Families might consider home care for their loved ones, and an in-home caregiver may prepare the meals and take the client on a pleasant outing to the grocery store. Or it might be time to move to an assisted living or other supportive living community where the seniors can enjoy healthy meals and companionship. Dining with others piques the appetite and reduces depression, which is another cause of an appetite loss. Next question, what if a senior has trouble eating or swallowing food? This actually is very common with a lot of different diagnoses. We see them all the time in home care. So if a person with arthritis, Parkinson's disease, or the effects of a stroke or other health conditions is having trouble eating, an occupational therapist can help them learn adaptive eating methods and use the adaptive utensils. Seniors that have chewing or swallowing problems due to missing teeth, gum disease, or poorly fitted dentures should receive regular dental care. Speech therapists help patients who have trouble swallowing. The person's healthcare provider or rehabilitation specialist can recommend methods of preparing foods that make it easier for them to eat. And if necessary, they might make a recommendation for nutritional replacement drinks. Next question, what if my loved one has Alzheimer's disease and has trouble eating? That's actually a very common problem with Alzheimer's patients. People with dementia may experience decreased appetite that quickly leads to malnutrition or dehydration. Or in the early stages of the disease, a person may overeat, forgetting that they have previously eaten with a diminished ability to tell when they are full. Experts recommend creating a calm mealtime environment, maintaining a routine, and offering finger foods and snacks throughout the day. An occupational therapist can recommend the use of adaptive eating tools. Talk to the person's healthcare provider about strategies and food choices. Next question, where can we find reliable information about nutrition? Here's some good sources of some information. The sponsor of National Nutrition Month, the Academy of Nutrition and Dietetics, offer a wealth of nutritional information for consumers, including a resource for seniors. Visit the health.gov website to read the article, Dietary Guidelines from 2015 to 2020. The National Institute on Aging offers a resource sheet on eating well as you get older, which includes links to nutrition support programs. They also offer a tip sheet on nutrition and dementia for caregivers. Well, that's all the time we have this week for Ask Dana. Please email me your questions at info@allthingshomecare.org.